Hello, everyone. I'm Dr. Grazia Aleppo, professor of medicine and director of the Diabetes Education Program, as well as Associate Chief for Clinical Affairs in the Division of Endocrinology, Metabolism, and Molecular Medicine at the Feinberg School of Medicine, Northwest University in Chicago. I'm here today with Michael, a person with diabetes, to talk about his journey and perspectives about living with diabetes and how the use of technology has assisted and improved in managing his diabetes. Hello, Michael. Please
Hello.
describe your please describe your journey after having been diagnosed with diabetes. What was your first reaction?
Well, I ended up getting it later in life. I went quickly from normal to type 2 for about a year, and then type 1, where I actually ended up as insulin dependent. And a little scary, probably a pretty significant adjustment. This is about 10, 15 years ago.
So, what were the issues that most concern you on a daily basis? For example, I give you a few: negative social perception, hypoglycemia, hyperglycemia, having the managing the diabetes burden, coping with diabetes. What was one of your concerns of all of these concerns?
I would say I had kind of two different types of concerns. One, sort of outward concern, such as, all right, how do I deal with this in front of other people? And then an inward concern, such as now actually it affects how you feel all the time, how you basically used to just eat and you're fine, but now when you eat, it changes the way you feel, and insulin, you have to balance that. And so you are managing the way you feel throughout the day differently. And on the internal side, on the external side, there are some times where, and you kind of start to get used to it, but on the front end, such as you're out with people, you're having dinner, you're at a restaurant, you've got to deal with this, and people don't actually understand, and you can get some very, very negative reactions as a result.
I totally hear you, and that is a big concern, but we have to really try to remove the stigma. So thank you, Michael. So what was your initial management plan? What were you doing in terms of your therapy? What were you doing for your insulin?
So I turned type 2 for a little while. That was use metformin. Metformin kind of worked until I went full type 1, which took over about a year. When I went full type 1, then I ended up with injectable insulin. Pretty quickly got on the fast acting and the long acting injectable insulin, and managed it myself with the meter. Every day you have to use the meter constantly, and then you have to use the injectable pen constantly, and so it was really a balance between those two, trying to avoid highs and avoid lows. I would say it takes a lot of practice.
And then you went on CGM. Remember those days that I said, Michael, why don't you go on a CGM? And how
Yeah,
did they help you?
yeah. So the original meter is actually kind of difficult because you don't know, and you check every once in a while, or you check when you're not feeling proper. You feel like your heart is pounding when you're low, and then when your blood sugar is very, very high, actually kind of messes with your vision. And so when you have the meter, you don't really know where you're at unless you get to the point of checking the meter and doing a prick on it every 10 times a day. The CGM is actually really nice when I eventually moved to that. I didn't know how easy it was. And yes, you have another appliance you sort of have on your body all day, but you have your phone pretty much in your hand almost all day anyway. And so you can actually follow what's going on throughout the entire day with the CGM. So watching the number the whole day, and it just becomes a regular part of you, and you know where you're at as opposed to guessing and responding to how you feel.
And then came the new thing that we discussed. And let me know, just describe for me how your journey into utilizing Afrezza Technosphere came about. Before you were just using multiple daily injections. And how did you first hear about inhaled insulin?
You're the one who told me,
I,
and actually, I used the injectable insulin and I thought that was really what was out there. I actually didn't even know powder insulin. Did a study, medical study with you. Largely, powder insulin, as I understand, has been in the market for a long time for managing diabetes, but the study was about using different levels of it to manage diabetes over the period of the day and over time. And so I switched completely over to powder insulin, breathable insulin. The long acting is what's really different is injectable insulin is two problems. One, you literally have to use a needle and you kind of take it out in public and using a needle and you're injecting that insulin and it is very uncomfortable having to inject it constantly. That goes away, and a Afrezza is basically just a quick breathe in off a little plastic device, and it's far easier, far more acceptable. The second thing is that the breathable insulin, it's much faster. So the liquid insulin, you inject it, you kind of guess at what you think you're going to need based on what you ate and the time. And it can take an hour, hour and a half before what you ate versus the injectable insulin kind of intersect each other. Where powder insulin, it starts happening about 15, 20 minutes right after you do it. And so it's very, very fast. You can use small amounts and actually use several times. It's fairly easy as opposed to trying to inject a whole bunch of insulin at once. And so, you have to get used to it because it's so fast. But it's really nice because you literally can breathe in a couple times over the next hour and you can move your number to exactly where you want it based on your digesting. So it's the nice thing about it. It's also in public. People kind of look at it, but they sort of think it's
A
like a
whistle.
cigarette or something. Yeah, they think it's a cigarette or something, but injectable insulin, even though that's been out for years and years, people really don't respond too well to that. Um, but
Okay.
it's nice because you could use it to respond very, very fast and it's easy.
Perfect. So let me ask you a question, Michael. What were your worries about using inhaled insulin when I suggested it? Did you have any worries, any concern, and how did you resolve this concern? And were there any more?
Oh, yeah. So original worries, I didn't know if it would actually work. I didn't know how it would work. I didn't know if it would manage sort of blood sugar the same way as the injectable. So that's some of the things that I was concerned about switching over to it is that I didn't want to have uncontrolled diabetes just because I was trying this inhaled insulin.
And that's very reasonable. So just going back to now that you've been using it, what were the things that attracted you to using a Freza once you started using it?
So the things that I liked about it once I started using it is that it's very fast acting. It's easy to carry around and use. You're not carrying a handful of needles and pulling out and using needles and having people stare at you. It's basically a little piece of plastic. You inhale the powder, and then you can also, because it's very fast acting, you can slowly work into what you're eating based on how many doses of the Afrezza that you're taking. So it's actually gives you more control.
Wonderful. So let's go back when we're thinking about how we did the onboarding process. When we trained you, how did you feel about the training? Was it complicated? Was it simple? It was in person. It was during the clinical trial. And did you feel that once we trained you, it gave you a security, a comfort, you could use it by yourself and, safely? Tell me how you felt when we trained you.
One of the things was just making sure that you breathe completely and let's compare it to what it's doing to your blood sugar and is it balancing properly. And so it showed that yes, you can use it actually more effective than injectable insulin because you are in a little bit more control.
So since you've been started using the inhale, how has it changed the way that you manage your diabetes? How do you feel by doing the inhale versus the multiple daily injection? I've been using it for several months.
Yeah, so I like it because it's I carry it with me all the time, and it removes some of the need to sort of deal with the fact of what you're eating. So you can eat, you can inhale, you can eat, you can inhale, and it's a 5 second process. So it gets you much closer to what I used to be before. Before I ended up having diabetes, that I can just use it, bring the number back down as what I'm eating, and manage it all myself. I would say that um, I I know there's other things like pumps or whatever. I frankly like this method because I'm more in control. I don't think I'd ever go to a pump because I feel that would put me not in control.
So right now you're doing very well, if I might say, from your last CGM that I took a look at. So I'm not complaining about that at all. And remember, this is a personal choice, and that's why we were talking about this. And so you were touching upon before on your burdens, the feeling that people will look at you, having the needle. How do you feel that Afrezza has changed this perception of, you say, the outward impression that you were mentioning before? How has it changed it for you, Mike?
Yeah, I think it to me looks a lot more acceptable. And so, and actually people ask about it as opposed to, if you pull out a needle and you start trying to, do your injectable insulin, they kind of stare at you and you pretty much would rather go somewhere else to go do it. And they actually ask about it. They're fairly curious. They're joke about it. And so outwardly it looks a lot better. You don't have any choice. But you don't have to explain yourself any really very much. That's kind of one of the things that's, I think, good outwardly. Like I said, inwardly, it's something I can literally have in my bag pretty much and use pretty easily. Injecting sometimes is a little difficult depending where you're at. I mean, you can pretty much take insulin on an airplane with a Frezza in the middle airplane seat. It's pretty easy, but injecting is not going to work too well.
No, so you totally. So would you say convenience and also feeling of security is something that you would consider a benefit for Fraser?
Yeah, I always have a handful of them, and I know how they work, and so I know that I can use it to respond pretty quickly. So, it makes it so that I don't have to worry too much about, oh, well, what do I do, or if I start eating, or I'm hungry, where I'm at. And so it's something you can always have in your pocket pretty easily. Like I said, it gave me more control. It's faster reacting than injectable. And so, you can, right when you're eating a sandwich, take, an 8 or whatever, and you know exactly what you're doing, and you know when it's going to come in. And so it overall allows you to not have to worry so much about what you have to do, frankly, every time you eat your whole life.
Sure. So if somebody had diabetes and you would have a discussion with a person with diabetes, what would you tell them about using a Freza? If they ask you and they have type 1, let's say, what would you tell them about what would they use? What should they use a Freza on? What you think about? How would you approach a conversation with somebody with diabetes and you're using a Freza?
You have options. Actually, that's kind of the nice thing. You have options. You can use breathable. It's got a lot of benefits. It's a lot easier. I moved to it in trial, and then afterwards I said, hey, I'd rather just keep doing this. And so I think you got to fit it into, how you want to manage yourself. If you have a chest cold or something, it's a little more difficult. But other than that, it makes it easier to manage what you have to.
So let's say that you're not speaking with me because I am your doctor, right? Speak with another clinician. What would you tell them about Afrezza if they ask you, hey, like we're doing right now, what would I prescribe to a patient of mine, Afrezza, instead of doing the usual multiple daily injection?
Well, I would say that, multiple daily injections is actually a lot of work. That's a lot of work for the patient. Breathable insulin is something that does reduce a lot of that work on the patient to manage it. Yes, there's other solutions out there. You can use a pump. I've know people that have a pump. That kind of takes the control out of their hands, and that may be something that they don't want to do. This is a For me, the solution works, and it works for the reasons I was saying, is such as I got more control, it's faster acting, it's fairly easy. It actually works quite well, and I haven't had any side effects to it at all.
And I'm very glad to see that you're doing so well with it. In fact, better than you were doing before. So when I think about what would I say to my colleagues or other people with diabetes about Afrezza, my experience has been initially I was a bit more hesitant, and I'm very honest to confess that because I want to make sure there were no side effects on the lung. And I wanted to do this study because I wanted to learn more about it. And that's when I had patients already on it, but not as many. And then when I did the study, not only I understood the person effect and their experience just like yours, psychologically, health-wise, but also understood how fast you can really approach glucose. And for example, you say, well, nobody, well, Michael, when people eat their food, it's a bit challenging, or sometimes very challenging, to match very well the insulin dose, the timing, and the curve of post-meal glucose. And Afrezza is so fast, allows you to multi-dose and to do a more sort of a personalized approach without having the tail that can cause low glucose, of which everybody, of course, is afraid of. So that was my experience ever since. I've had more patients on Afrezza. And again, the thing that is important is to talk with the patient. As you and I talked about it, we need to give the option, present the option to the patient. Everybody is different. I believe that that is the beauty of the many options we have today in medicine. And so you can't just go cookie cutter. We had to work together on that. Remember, so it wasn't just from 0 to 100. Even the study was like, is it going to work? And it worked beautifully, but it was a learning process for myself, for you, for the study team, for everybody else. So I thank you so much for doing this conversation with me. It means a lot. And I'm very impressed with all your results because you really have engaged so beautifully with your health, always, to be honest with you. But now you're more, I see that you have this truly this you sort of clicked with your insulin, and it's easier for you, which is, as you say, it's every day, every meal, every hour of the day for the rest of your life. You have to be able to handle this more sort of freely, and I think that you've been able to do that. So I thank you again for joining me today, and I thank everybody for being with us today. Thank you so much, and have a good day.
Thank you.